My name is Mary Christopher, 56 years old. I originally came here to see Dr. Peters to treat a diagnosis of lumbar stenosis and was in a lot of pain at the time. Had tried several things: pain management, physical therapy, pretty much everything else in the book. And I had seen a couple of doctors prior and basically got tired of the passive approach. So after a couple of years of just couldn't tolerate the pain anymore, came and saw Dr. Peters. I like Dr. Peters, and what after looking at some of the reviews and some of the surgical capabilities that he has, one of the things that I liked was he does minimally invasive. Minimally invasive procedures I like because there's a lot less recovery time, a lot less downtime. And anyway, so I came in to see him, and he did all the diagnostics that needed to be done, MRIs and whatnot, and turned out I was a candidate for minimally invasive. It was L4, L5 fusion. And so we went ahead and scheduled the procedure, and things pretty much went off without a hitch. My primary concern was I cannot take opiates. I get violently ill off of them. So I had a lot of concerns about the pain factor and how I was going to deal with that. And as it turned out, it was about a 4-hour surgery. And after the fact, I was pleasantly surprised the very next day. Virtually pain-free. It was for the most part pain-free after the surgery, pretty much right after the fact. As soon as I could be conscious after that, it was really not that bad. And then, so within a couple of days, I was out of the hospital and pretty much business as usual. Came in and saw him 1 week post-op, and he was even surprised at how much I was walking around and asked me how I was doing, and I said I was ready to go back to work, which he did not let me do. But actually returned to work in 5 weeks as opposed to the 6 weeks. Saw some people about a couple of weeks post-op at work, went and had some lunch with some friends, and many people were quite shocked at how well I was getting around after only 2 weeks post-op. And frankly, it was kind of hard to not do too much. So, but anyway, I would highly recommend Dr. Peters for this procedure. I'm very pleased with the results. Love Dr. Peters. His bedside manner is phenomenal. And I've also recommended him to several friends that I know that deal with the same thing. So, and I know what kind of relief that they can potentially get. So, anyway, that's my story.